Hello, lovely people. How are you doing? Welcome back to my channel. This is NCLEX Target. It's been a long time, and thanks for having me once again. Please, if you are new here, you try to hit on the subscription button, okay, just below, and then you hit on the notification in case we have any content. Then you'll be able to have access to them immediately we post it. Okay, now today we are going to look at one of the dangerous conditions called hyperthyroidism. During our previous lectures, we were able to discuss what is meant by hypothyroidism. So today we are going to look at what hyperthyroidism is. Okay, now when you look at hyperthyroidism, it has to do with the hypersecretion of the thyroid hormone. And then you know that when it comes to thyroid hormone, they are very, very important. They play a major role when it comes to metabolic activities or metabolism. Okay, so it means that in the absence of the thyroid hormone, definitely you are going to have something that we call hypothyroidism. That means that there is hyposecretion or low secretion of the thyroid hormone, okay, which is not very, very pleasant in our system because everything of the system is going to go low, as we discussed in our previous lectures. So let's look at when the thyroid hormone is highly secreted. That means that there's going to be hypersecretion of the thyroid hormone. And what are the thyroid hormone we are talking about here? The T3 and the T4. Okay, we have the levothyroxine, which is the T4, and then we have the triiodothyronine, which is T3. Now, when you talk about the thyroid hyperthyroidism, the thyroid state resulting from hypersecretion of thyroid hormones. And what are they? The T3 and the T4, which is the triiodothyronine and then levothyroxine. Okay, now these particular hormones play a major role in a situation whereby the thyroid hormone is low. The thyroid stimulating hormone. Now listen to it. Stimulating. That means that if you are low, then I need to what? To ginger you or what? Stimulate you to be able to produce more. So in the situation of hypothyroidism, there is going to be increase in the thyroid stimulating hormone so that the thyroid hormone, which is the T3 and the T4, will be highly secreted and then help the body with its metabolic activities. So what if the thyroid hormone, which is the T3, T4, is high? That means that the thyroid stimulating hormone is going to go low to be able to reduce the activity of the thyroid gland, which will tend to also try to decrease the secretion of the thyroid hormone. So it is very, very key when it comes to the thyroid stimulating hormone and then the T3 and the T4. They are very, very important. All right. Now, this particular hyperthyroidism is characterized by an increased rate of what? Metabolism, or there is increase in metabolic what? Activities, because everything of the system is going to go high. All right. The patient is going to starve. The patient is going to be agitated. Why? Because there is increase in metabolic activities. So imagine you having increased metabolic activity. It means you are not going to be at peace at all. It is very, very dangerous. All right. So let's look at the cause of this particular hyperthyroidism. We have something that we call grave disease. All right. You can also call it toxic diffuse goiter. This particular condition is very, very critical when it comes to hyperthyroidism. All right. They are the sole cause of what? Of hyperthyroidism. We can also have thyroiditis. Okay. Now, thyroiditis has to do with inflammation of the thyroid gland. Okay. It can also lead to hypersecretion of the thyroid hormone, which will in turn to cause very serious condition or increase or highly elevate the metabolic activity within the system. All right. Now this condition, okay, when it comes to the condition, all right, clinically manifestation also referred to as what? Thyroid toxicosis, okay, or thyrotoxicosis. Now, thyrotoxicosis, we are going to talk about this particular one because here, okay, the patient system, okay, is going to be severely affected to the extent that everything is going to move higher. The blood pressure, when it comes to the central nervous system, the patient is going to be agitated, confused, and then disoriented. A whole lot of things are going to be happening. All right, and then the blood pressure is also going to be increased when you talk about the cardiovascular system. Okay, and then there's going to be tachycardia, elevated what? Pulse rate. Everything is going to be affected with the exception of what? Weight and then thyroid stimulating hormone. So let's see what the clinical manifestation of hyperthyroidism will be. there is going to be heat intolerance. Now, when you talk about metabolism, you know heat is the what? Is the byproduct of what? Metabolic activities. Now, this patient is what? Is producing heat internally. How much will you think that the patient can tolerate external heat? It becomes very dangerous. Okay, so the patient is not going to what? Tolerate any external heat. So the patient is going to have heat intolerance. So it means that you need to provide the patient or nurse the patient in what? In a cold environment. It is very, very important. So there's going to be heat intolerance in hyperthyroidism. Unlike hypothyroidism where there is cold intolerance, because for them, the activity of the what? Of the system is low. Okay, so there's cold intolerance in hypothyroidism. Why? Because the system is not producing heat to be able to help the patient regulate the patient temperature. In this case of the hyperthyroidism, the patient is going to have excessive heat production. Thereby, okay, he himself is feeling warm. So he cannot tolerate the external heat. So we call it what? Heat intolerance in hyperthyroidism. And then palpitations. Okay, palpitations are going to what? Be present. The patient is going to feel palpitation. It's very, very severe. That is the cardiovascular system. And then there is also going to be hypertension. The blood pressure is also going to go high. Okay, because activity of the system is going high, everything is going high, with the exception of what? Weight and then thyroid stimulating hormone. Diaphoresis, excessive sweating, especially at night. Okay, excessive sweating. Listen to it. Excessive sweating. Diaphoresis is going to be present, and then there's going to be exophthalmos. Now, exophthalmos is like a topic on its own. Don't worry, we'll be talking about it. Okay, exophthalmos. Okay, abnormal protrusion of the eyeball. The eyeball is going to be protruded. What do you call it? Protruded. It's going to be highly, protruded. Why? Because of the what do you call it? Hyperthyroidism. Okay, it's going to be serious. Why? In this case, we have a way of managing it. We'll talk about it later in what? In our lectures. So exophthalmos is going to be present, and then tachycardia. There's going to be increase what? In the cardiac heart rate. Okay, the heart rate is going to be what? Is going to be elevated. Tachycardia is going to be present, and then nervousness. There's going to be nervousness, and then fine tremors of the what? Of the hands. Fine tremors of the hands. The patient cannot stay at once. They'll be shaking of the what? Of the hands. Okay, why? Because of what? Hyper or high metabolic activity within the system due to what? Hypersecretion of the T3 and the T4 or thyroid hormone. And then there's going to be irritability. Agitation is also going to be present, and the patient will be having mood swing. Okay, mood swing. All right, and then there's going to be low weight loss. Why? Because there's increased metabolic activity. The patient, okay, is digesting a lot of calories within the system. All right, and then because there's hyperfunction of almost all the system parts. Okay, the patient needs a lot of energy. And then the weight is also going to be because there's a demand in the what? In the nutritional requirement of the system. This is very critical. And then also low thyroid stimulating hormone. And I told you initially that the thyroid stimulating hormone is going to what? Ginger the production of the thyroid hormone by the thyroid gland. Okay, so it means that in as much as the thyroid hormone is high, okay, the thyroid stimulating hormone is supposed to go low to be able to what? To ensure proper hemostasis within the system. And then the thyroid gland is also going to be enlarged. It's going to be enlarged. So listen here very carefully. Everything is going to go high with the exception of the weight, with the exception of the thyroid stimulating hormone, and then also the thyroid gland in this particular system when it comes to the assessment. So take notice of it, okay, so that when you meet it and then when you are solving questions under hyperthyroidism, you should know, okay, what you are going in for. Everything goes high with the exception of what? Thyroid stimulating hormone, the TSH. The weight, there's going to be weight loss, and also there is going to be what? Enlargement of the thyroid gland, okay, goiter. That is what we are going to talk about. Okay, now let us look at the intervention of this particular condition, because the patient is going to suffer a lot. Okay, so how do we intervene? Remember, the patient becomes restless. The patient cannot rest due to what? Hyper or increased metabolic activities. All right, so we need to ensure proper rest. Adequate rest is very, very important, okay, when it comes to hyperthyroidism. And then we need to make sure the environment is cool. Cool environment. It's very important because the patient, okay, everything irritates the patient. That's why the patient becomes what? Irritable. So the environment should what? Should be cool enough and then very quiet. Very quiet. Because the patient cannot tolerate external heat. So the environment is supposed to be cool and it's supposed to be what? Quiet. Because of what? Heat intolerance and agitation and the irritability. So ensure cool environment and then quiet environment. You need to obtain daily weight because there is going to be what? Weight loss in hyperthyroidism. So daily weight is very, very important. With the same what? Clothing or cloth, and then with the same scale, it will help us to what? To monitor the weight of the patient a lot. To what? To be able to ensure proper weight monitoring. All right, so that we know that the patient, whenever he or she is gaining weight, will be able to know that at least the problem is resolving when the patient is on proper medication. All right, and then we have to also need to provide the patient with what? High calorie diet. Remember, there is high demand of what? Of the calorie in the system because the metabolic activity is increased. So we need to provide the patient with what? High calorie diet. It is very, very important. And then also, please take note, we can give sedative to be able to what? To put the patient into rest. A little amount of sedatives is okay to be able to put the patient, okay, at rest. And then also take note, when we are solving the question, okay, in the NCLEX, all right, we don't need to give a stimulant in patients suffering from hyperthyroidism. Stimulants are very, very dangerous. Already the patient is agitated, confused and stuff. You don't give anything that will aggravate the symptoms. Okay, so don't give stimulants. They are very, very risky when it comes to this particular condition called hyperthyroidism. So please take notice of that. It is very, very important. And also, we can also try to what? To administer antithyroid medications. Now, the antithyroid medications, remember, there's high amount of what? Thyroid hormone. Let's give something to help the patient out so that, okay, there can be a blockage of what? Thyroid hormone production. Okay, and what is the drug? Metimazole. Metimazole is what? Is the drug of choice that we mostly give to what? To reduce the hormone of what? Of the thyroid gland. So you give metimazole, or we can also give propaterosol. Okay, or propaterosol is the drug, or metimazole. Propaterosol or metimazole is a drug of choice that we can give to help the patient. We can also give what? Iodine preparation. We can administer iodine preparation. You know, iodine preparation is very, very important. This one will what? Will try to reduce the what? The thyroid cells, okay, their activities to be able to reduce the high production of the thyroid hormone. Okay, it is very important. And then we can also administer propranolol. You know, there's going to be tachycardia or increase in pulse rate. So giving the propranolol, the beta blockers, the low medications, all right. So we give it to be able to reduce the pulse rate or to reduce the tachycardia the patient is suffering from. And then we can also administer radioactive iodine, okay, or radioactive iodine preparation is very important to destroy the thyroid cells. And then take note, we should also have to let the patient express concerns about the body image because the thyroid gland is going to be what? Increase. So we have to encourage the patient because the patient become nervous and then the patient become anxious of his or her condition. Allow and encourage the patient to express him or herself. In the NCLEX exams, it's very, very important. Now we mentioned that there's going to be exophthalmos because exophthalmos, as I told you earlier on, okay, it is part of what? The complications of this particular condition. There is a proper management of it because there's going to be abnormal protrusion of the eyeballs. Okay, how do you manage this one? We have to elevate the head of the bed. It is very, very important. All right, let's try to elevate the head of the bed, and then we can give a low salt diet. A low salt diet. Okay, let's give a low salt diet because remember, when the pressure increases, okay, it's going to affect the patient vision a lot. So let's give what? A low salt diet, okay, in this condition called exophthalmos, okay, as a complication or as a symptom or assessment of what? Hyperthyroidism. And then because the eye is protruded, the eyelid will not be able to cover the eyeballs. So what we do is that we have to properly give the patient what? Tears. Okay, we can give the patient artificial tears. This one will what? Will try to lubricate the eyeball to protect the eyeball from drying up. You know, when it dries, when the eyeball dries, is what, okay, there's going to be a very serious complication. So take note of that in there whenever you are solving the questions under exophthalmos. Okay, it's very, very critical in hyperthyroidism. Give artificial tears. And then we can also encourage the patient to use what? A sunglass or dark glass, especially when the patient want to move under the scorching sun. All right, under the sun, sunglass is very, very important. And then also we can tape the eyelid. Okay, the eyelid, especially when the patient is going to sleep at night. Okay, when the patient is going to sleep at night, we can what? Give or tape the patient eyelid to be able to what? To close the eyeball to protect the eye from drying up. It is very, very important in the NCLEX whenever you are solving the questions. Now, let's see something here. Let's look at the complication of hyperthyroidism. You know, we have something that we call thyroid storm. It's the worst form. Okay, it's a life-threatening condition. And then of this particular one, it means that the situation of the patient is going to go extremely high. So the blood pressure, hyperthyroidism is going to occur. Agitation, nervousness is going to be severely high. Let me use that one. So it means that we need to what? It becomes an emergency, and there's what do you call it? There's going to be enlargement of what? The thyroid gland. So airway in this condition, take note whenever you are solving the questions. Okay, the airway is very, very important. Secure the airway and ensure proper ventilation. Okay, in this particular condition, it is very, very important. All right, so we need to try to secure the airway in thyroid storm. That is the priority in solving the prioritization questions. Okay, airway is very, very key point to take notice of it. Okay, take note. And then also we can do the surgery. Okay, and then the surgery is what to be by thyroidectomy, removal of the thyroid gland. And then you know that the parathyroid gland is also on top of the thyroid gland. So whenever you are removing it, definitely, okay, it's going to affect the parathyroid gland. We'll talk about it, what will happen, okay, in our next lectures. Okay, so stay tuned. Thank you very much once again. And then we are doing NCLEX. Okay, if you want to have a proper content with proper explanation in the simple form, okay, you can contact us on my creator at gmail.com. Okay, so it's very, very important. Contact us. The email will be posted, okay, at the end of the video, so that you contact us for your proper content. It's very, very important. Okay, so please take note of this. Remember, NCLEX is doable. All right, NCLEX is doable. So please take notice. And then we have 100%. Okay, when it comes to the content, we provide you with the materials needed to pass the NCLEX, and then we'll also try to enlighten, teach you proper content, so that whenever you are solving the questions, you know that you are actually doing the right thing. So take note of it. Thank you very much once again, and then we'll meet again. Have a nice day. Bye-bye.